Welcome back, everyone. You are enjoying another episode of Fast Facts Pharmacology Edition, brought to you by a Tale 2 hygienist in partnership with Elevate Oral Care. And now, please welcome your host, Tom Viola.
Hi, I'm Tom Viola, a certified pharmacist, dental educator, and author. Stick with me, and I promise to make the next few minutes the best pharmacology learning experience you've ever had. Hi everyone, Tom Viola from Pharmacology Declassified. We get another Fast Facts Pharmacology Edition. Well, we're continuing in our series of Fast Facts on dental pain management. And in the next installment, this one, we're going to talk about the physiology of pain. Why does pain occur, and what makes dental pain so different from other kinds of pain? Well, we do know that when tissue is damaged, when you damage tissue, as we do in dentistry, right, therapeutically, we damage tissue. When you damage tissue, substances, naturally occurring substances in the environment of the tissue called algogenic substances are released from that tissue. So acute tissue damage yields this release of pain-producing or algogenic substances. What is the job? What is the role of those substances? To seek out a receptor, latch onto that receptor, and send a message to your brain that says, hey, we're out. We escaped. There's probably something wrong down here. There's been tissue damage. Get on it. And so those substances are very valuable for us as far as being able to determine if tissue has been damaged. But the message that gets to the brain is indeed one of pain, a noxious stimuli that makes you stop in your tracks and say, what was that? Okay, what kind of substances are we talking about? Things like adenosine triphosphate, but also things like serotonin, histamine, bradykinin, cytokines, and the dreaded P word, prostaglandins. Well, we know when those substances are released, they initiate the pain response. They sensitize the nociceptor activation. But at the same time, they can continue to stimulate that nociceptor activation and therefore increase pain over and over and over again. So that's why dental pain is so noxious. It's because it doesn't just start as pain, it continues to be rather painful. And so while your patient's urgently aware that they've damaged their tissue, treating that pain from the damaged tissue, it becomes a problem because it's hard to shut off the pain message. So I guess the only way to do it would be to neutralize those pain-producing substances, right? Those prostaglandins especially, right? And as you'll see in our later versions of Fast Facts as we talk about pain management, that will involve the use of things like NSAIDs and acetaminophen. But remember, there's the inflammation component as well. You know, inflammation causes swelling. Swelling causes a decrease in blood flow to the tissue. Well, the tissue needs blood flow because blood brings to the tissue what it needs to heal. So by shutting off the blood flow even slightly, that delays the healing of the tissue and therefore further increases or prolongs the pain response to the brain. So, as you may have heard me say before, if you've heard me lecture, dental pain is different because it's acute inflammatory pain, and therefore the best way to treat it would be with an anti-inflammatory. But NSAIDs alone aren't enough, and that's why we add acetaminophen to the mix, and that'll be the subject of yet another Fast Facts Pharmacology Edition on the management of dental pain using combinations of analgesics. But don't forget things like caffeine, which can boost the analgesic effect of things like acetaminophen and ibuprofen, provided your patient can tolerate caffeine and their doctor has given them clearance to use that caffeine. This is Tom Viola. We had another Fast Facts Pharmacology Edition. Join me next time for yet our next installment in this pain management series. Until then, take care. Oh, and one more thing. If you want to hear more from me, be sure to follow me on Instagram, Facebook, or visit my website at www.tomviola.com.
Thank you for listening to another episode of Fast Facts Pharmacology Edition, brought to you in part by Elevate Oral Care, creators of the innovative and proven prevention-focused oral care products from Advantage Arrest Silver Diamine Fluoride to Fluoramax Sodium Fluoride Varnish. Learn more by visiting www.elevateoralcare.com and schedule your free CE staff meeting today. We'll see you next time for another Fast Fact.